BioPA here with 911 BioCare. Welcome to part 3 in our adrenal fatigue series for the week here. In part 3, we're going to go more into depth into recovery from adrenal treatment and recovery for adrenal fatigue. The treatment of adrenal fatigue, the first thing that you need to do is you need to find a specialist who truly understands adrenal fatigue, who recognizes it as the entity that it is and has experience treating it. The reason that this is important is because you got to understand that modern medicine, in some ways, many of them don't even recognize adrenal fatigue or know anything about it. Now, there are some that do. I am seeing adrenal fatigue pop up as a diagnosis, coming out of ER visits and other things more and more. But that doesn't mean that, that those folks are adept at treating it. The second thing is, adrenal fatigue has a lot of crossover in the signs and symptoms with other things like low testosterone, low sex hormones in women, so progesterone, estrogen imbalances, things like that, thyroid issues. There can be a lot of crossover in these things. So the treatment plans and what you put as a priority and how you do these things can vary quite a bit from the provider's perspective. Also, your body is very complex, and so since some of the adrenal hormones like cortisone and things like that are in the cascade of sex hormones, then that they can be affected, and in some ways sometimes the body can kind of rob from those, or rob from the precursor hormones like pregnenolone, DHEA, before they make it to the sex hormones in order to try to make what it needs to deal with stress, because it tends to put that as a priority over some of this other stuff. Also understand that it takes some experience to not go after the wrong problems, because things like adrenal fatigue can affect other things like thyroid function. And sometimes it's more appropriate to treat the adrenal fatigue and then kind of give supplements to optimize the thyroid than it is to go directly after the thyroid. Now, what does adrenal fatigue treatment involve? Well, in its simplest form, it's going to take at least 3 things. So I always say, it's like a triangle. So 3 parts of the triangle. One part of the triangle is going to have treatment by a good practitioner who is trained and experienced in bioidentical hormones and bioidentical medicines. Okay? And they have to get a treatment plan for you. They've got to do some blood tests. They've got to monitor things, and they've got to help you, because this is kind of a dynamic process. So that's part of it. The other part of it is having proper diet, proper supplements in that diet, because of 2 things. Number one, we had a video before that talks about toxic load. If you're eating all the wrong things and drinking the wrong things and drinking, bad water and stuff like that, these things have an impact on your hormonal system, and in addition to that, they cause a lot of stress and a lot of inflammation. And if you're creating inflammation and stress in the body, you're burning up cortisone in order to try to fight that inflammation. So, you got to reduce the demand in one way. The kind of other side of that coin is that you have to provide the body with everything it needs in order to recover. And everything that it needs are proper nutrients, which include live enzymes and probiotics, which you're not going to get from highly processed foods. If something's pasteurized, you kill all the enzymes and probiotics. If something is highly processed, if it's an animal that wasn't fed right, you're not going to get that stuff. Okay? And no matter how well you eat, especially in this modern lifestyle, it just may not be enough. So you need good, high quality supplements, and you need the right ones. Okay? So this is a whole nother thing in and of itself. You got to get the right supplements. They have to be bioavailable. They have to be high quality, and they have to be given in sufficient quantities at the right time. And that, what might be the right quantity at this point, you may need more or less down the road. It can change. But the main thing is, going somewhere where you get what you pay for. And that may, mean that you have to spend a little bit more money. But even if you don't have a lot of money, you want to get the best thing for the value that you can. One of the problems with supplements is that because they're not regulated, then there's some issues. They've been tested, and some studies have shown that sometimes not only do you not get the amount that they claim per pill, but sometimes you don't even get the ingredient. Sometimes they're just sugar pills. Sometimes they've got a different ingredient in them. It's kind of like the Wild West out there. So, we want to help guide you to give you, what's best for your money, because more than anything else, you don't want to waste your time. You don't have time to waste for failures here. Okay? So that's important. So proper diet, proper supplements. Proper diet, in my opinion, really includes, as many raw, whole foods as you can incorporate in your diet realistically, organic, high quality, those types of things. And that's, a whole nother video in and of itself. So that's one part of the triangle that you have to do at home. The other part of the triangle, it's at least a triangle that might have more sides, but the other part is stress management and proper sleep. I'm going to kind of lump those together. Stress management comes down to, it could be any technique for you, but some of the big things that we find in stress management are things like mindful meditation. That's a big one. Possibly, meeting with a therapist somewhat regularly, just to kind of have someone that is a neutral party that you can bounce things off of. Definitely mindful meditation. And then, proper exercise. That could be, wow, did I forget exercise? I don't know if I forgot it or not. But proper exercise definitely is part of that, and regular. It could be as simple as you taking, a brisk walk, 3 to 5 times a week. But it can go more than that. Well, I don't want you to overdo it, but you need to get moving. Okay, you can't be sitting still. You can't be sitting on a couch and get better. And then we have to address the components and quality of good sleep. If you are not getting quality sleep, meaning that you're not reaching the deep levels of sleep in a night on a regular basis, then you are not able to heal and recover from the stresses and damages of life very well. So we have to get that part of the puzzle improved as well. What is the timetable? Everybody wants to know the timetable. I don't know. it's different for everybody. If you're very mild, I mean, but it could be fairly soon. If you're moderate to severe, it's going to take a while. It's going to take months, years. I mean, especially for moderate to severe, definitely severe. I think we're talking, 2 years um, as probably more of a minimum. And once again, hopefully, our goal in that time is that we're giving you new skills and helping you develop new habits that you will take with you throughout your life. That's really the key here. It has to be lifestyle changes. We've got to incorporate some significant lifestyle changes. And if we can do that, you're going to be healthier all around. That's the exciting part, is that we're going to improve your quality of life forever. And everything is going to grow from that. Your energy levels are going to go up. Your relationships with people are going to get better. Your irritability is going to go down. You're going to be more in touch. You learn to be more in touch with yourself. You're going to be able to manage and handle stress better, because life is life. Stress happens. Things don't go our way. Stumbling and failure and setbacks, it's part of life. Those things happen. It's how we deal with them, how we manage that stress, that really is important. You can't avoid those things completely. I mean, yeah, you can make better decisions, but even in the best decisions, you can't always avoid these things. So we want to empower you to give you the tools to deal with these things for the rest of your life. And the bulk of that is how you think, what your mentality is, and how your attitude and outlook on life, as well as what you put into your body, and we're here as a guide. Definitely balancing the hormones is part of that. Giving you some bioidentical medications. It's sometimes necessary, especially for people who are in severe adrenal fatigue. That may be necessary for a while. But this is a slow process. However, you will feel better fairly quickly. I mean, you'll feel better within a few weeks. 2 to 4 weeks probably, if not sooner. Some people feel noticeably better. But then you kind of get used to that, being at that level, and then you kind of forget. We have short memory for pain, I think. So then you forget, and then you kind of get frustrated, and you're like, because you get a big change in the beginning, and then you get little changes that continue on, as time goes on. Because remember, you didn't get to adrenal fatigue in 2 weeks, so you can't expect to get out of it in 2 weeks. You got there little by little. You got into this hole, by digging little by little, daily, with a spoon maybe. Shovel, shovel, shovel. After years and years and years and years of, digging with a spoon, you're now in a hole trying to get out of it. Well, now you're going to have to change your tactics and techniques, and you're going to have to take that spoon. Maybe you can get a better tool with time, but you're going to have to fill that hole back up, and it's going to take a while. Maybe you'll be able to do it 2 or 3 times as fast, but it's still going to take some time. Thankfully, as you do it, as you fill that hole in, you get higher and higher, and your perspective changes. Think about the first day that you can see over the top of that hole. Your entire perspective is going to get a lot better, because instead of being in a dark hole, you're going to be able to see the world around you, and at some point you're going to be able to climb out of it. So, that's kind of where we're at. The prognosis, if you're correctly diagnosed and correctly managed, is extremely good. And along with your recovery from adrenal fatigue, I can guarantee you that your general health is going to get better, your chronic illnesses are going to improve, and quite possibly with time you may be able to go back to your doctor and either reduce or maybe even get rid of some of the chronic medications that you're on. But we will improve your overall health and well-being, and we'll improve your outlook on life, which will improve your productivity, which will improve your relationships. And most of all, you won't feel like you're walking around in quicksand all the time. You won't feel like you're drowning every day, like you're struggling to keep your head above water, like you're treading water every day and getting tired. If you've been there, you know what I'm talking about. So those are the exciting things. The exciting things, I think, are that we understand this is a problem, it is a real problem, and we have solutions for you. No, there's no magic pill. I can't give you a pill when you go home and sit on the couch and you're going to get better. Not promising that. Anybody who does, you need to be very concerned about it, because it doesn't exist. I wish it did. We're all hoping for that, but the truth is, reality is, life and nature doesn't work that way. So, we're here to teach you and empower you to give the tools to recover from this disease, this syndrome, which affects so many people, and more as time goes on, and help you get better and help you live a better life all the way around. And it's not impossible to do. It's not an impossible task, and it's not something that you have to do perfectly from day one, or that you have to do everything at once. We're building new habits slowly, and you do that at whatever pace you do that at. But our job is to teach you. Our job is to be here and give you the skills that you need, the knowledge, etc., to overcome these things. And that's part of what we do. So once again, let's kind of go back and touch back on this book. Yeah, I wish we were selling it, but I'm a big fan. We're not making any money off of this. Dr. Wilson, James Wilson, has specialized in adrenal fatigue for a long time, and it's just a darn good book. So we highly suggest that you start out with this, whether you're being treated for this or whether you're just curious about it, or whether you know someone that you think might have adrenal fatigue. This is a great book, a great reference for you. And I recommend it to all my patients. And this kind of is, your homework, what you need to do at home, above and beyond following, treatment plans that I give you. You have to do this other stuff at home if you really want to make a full and 100% recovery from this, and really probably live a better life than you ever have, because you're gonna feel great at some point, and yet you still have the knowledge of and experience of how someone at whatever age you are. So you're gonna feel younger, but you get all your knowledge and wisdom. Okay, so I hope that this has helped some people or touched some people. It's a huge topic. I mean, we really could go on for hours about this and all the nuances of it. One thing that I forgot to touch on before, I guess I'll touch on real quick, is that your adrenals being low can have effects on other parts of the body. So it's a cascade effect, and it can go both ways. But one example is cortisol or cortisone is key in the conversion of T4 to T3 in the thyroid. So some suboptimal thyroid function can also be impacted by adrenal fatigue, because you don't have enough cortisol in order to make those conversions. So that's one thing. Sorry, something else I forgot was, how do you determine adrenal fatigue? You see a provider who's adept in that, who's experienced. They may do some blood tests or some saliva tests. probably doing cortisone tests numerous times throughout the day is a much better indicator of potential adrenal fatigue than just doing like an 8 a.m. cortisol. I don't think that's really a great indicator. So you do have to do some different testing, but mostly you have to have someone who's willing to sit down and talk to you and listen to you, because really that history and the story that you tell is really going to tell me truly what's wrong with you and what's going on more than anything else. The other things are just evidence to kind of confirm or back that up, but ultimately the story that you tell me is really one of the most important diagnostic tools. So thank you for listening. I hope you got something out of this, and we'll see you soon, and be well.